Hello, good to see you. Hello, can you unmute yourself?
Sure.
There you are. How are you?
I'm good. I'm a lot better today. The other day, I don't know, my arthritis in my back just started in, and I was like, oh, I was sitting there trying to get comfortable, and it was so painful. But I'm fine
Oh.
now. It's raining, and I'm fine. Go figure. I'm a West Coast girl.
Yeah, yeah. Oh my gosh.
How are you?
I'm doing good. I'm doing good. I yeah, it's a little cooler here, which I'm grateful for, so it'll be a nice cool weekend.
You're in Idaho.
Yeah, yeah.
I know the first day of summer, and it's supposed to be 59 degrees. Woo!
We'll take it. We'll take it because we need
Yeah.
it to warm up. I like the heat though. I don't mind it at all.
Well, I like the sunshine. I don't like too much heat. I know. Yeah, I when I went to Australia to visit our kids, they when they first moved there, it was 42 or 44 Celsius, which was like 111, and it was humid, and it was. I think I got heat stroke or something because I got so sick from the heat, and I have not been able to really tolerate it ever since. So
Oh, interesting.
yeah.
Uh,
So I don't know if that's true or not, but now, when it gets real hot, it's like, oh, cool everything down quick.
Yeah, yeah, exactly.
But I
Oh,
love the sun.
yeah, me too. Me too. Oh, there's lots of people coming in. Hi, Clarice.
Oh,
Hi,
good.
Maria. Hi,
Hey,
Audrey. Good morning. Hi, Jesse. Hi, Antonia. Welcome. And Suzanne is joining us. Welcome on this Friday morning. Oh my gosh, can you guys believe we're at week 8 already? My goodness, where did the time go? You guys had lots of homework too. I hope that you've been able to take some time to kind of work on the homework, even though it is review. Really just allowing yourself to absorb the information, but also kind of, um, and it's all, of course, when you do your homework, open book. You can always go back and review your notes. I do that all the time, and so really, each time we touch that homework, even when we go back to review, that's just another way to kind of allow that information to integrate. And just remembering that you don't have to remember all of this. All of this is available to you all the time. And like I mentioned before, I refer back to my stuff a lot. I have a new client who's starting, she's doing well. Um, she's 92, but she's beginning to notice some decline, and it's just been really good to know that I have my information to review back on, and kind of more of a care consulting, elder care role that I'll be playing right now, but know that we'll be moving into that space of being her doula later because she's a solo ager and doesn't have family. And so I'm just really excited to be in that space. I wanted to share with you guys that, I've been doing this for a little bit, and it's just amazing. You just never know the people that are going to come into your sphere. You just never know who is watching, who is saving your phone number and tucking it away. I've just been surprised over and over again by, like, I met you 2 years ago and I'm ready for you now. So just keep plugging along and keep doing what you're doing, because I think you will be surprised on who's watching, who's waiting for you. It's just kind of out in that outer sphere of, your energy field, just coming in, and yeah, so just be open. Sometimes I really want things to like happen now, right? And so I think the universe has such a great, beautiful plan for each of us. So yeah. So this time is about you. I wanted to check in to see how your homework is doing, and just see how things are going. Clarice has a question. You know what, you guys? I'm going to mute myself for just a second. I forgot to put my earbuds on, and my husband's watching TV, and I just don't want you guys to hear that. So I'll be right back. Okay.
I see I'm still unmuted, so I'll just say hi to everybody this morning. It's raining out here this morning in Vancouver, BC, and it feels kind of good. It's the first day my arthritis in my back hasn't hurt. So it's barometric pressure, I guess, that's doing it to my back. So I'm fine until the change is coming. And boy, when the change comes, it hurts. Okay.
Thank you,
I,
Heather.
I
Thank
just
you.
filled in. I just filled in for a minute. Now I'll
I
mute
love it.
myself.
Thank you. I find my earbuds help so much because it kind of, the garbage truck is, coming around and stuff like that. So I feel like I want to be able to be here right now. So let's see, there's a couple of questions in the chat. Let's go in there. So Clarice says, I'm having an advanced directive Zoom meeting with two generations of my family. Amazing. The DNR can be signed without a doctor and given to the doctor, have on the refrigerator, is it legally binding, different than most imposed and living will? Clarice, I want you to come on if you can and just kind of talk a little bit more about that. Can you, so you're having a family meeting and I'll let you explain. Let's go into that.
Yep. Uh, so my oldest brother is in his early 80s. And then I have two other siblings. We're spread around the country. And then there's the next generation, our kids, etc. So the next generation is involved not because they think they need it, but they want to know what my generation wants and needs, right? So I have looked at the 9 questions, and also in the library is the Peaceful Planner about, to get people think about what they want. But we want to start by talking about the legal documents. And I know the living will is not a legally binding thing. I know that depending where you live with your doctor, you fill out the most or the post forms. But I've heard that the DNR, you can just sign yourself, and on its own, it is a legally binding document. And that's really what my question is.
If the DNR is legal, yeah,
Yeah,
so the DNR needs to be signed by a physician.
it does. Okay.
Yeah. Which is pretty easy. You can just print your there are DNR DNI forms on your they should be on the health and wellness health and welfare form should be there somewhere on their website, and there as well as the advanced directives. I know
Yeah.
here in Idaho, they need to be, it's strongly recommended to register it with the state, and it can be changed anytime. But the DNR does need to be signed by a physician. You understand that it's different than the MOLST or the POST or the POST. Those are two different documents, but the DNR does need to be signed by a physician. Yeah, yeah,
Okay.
yeah.
And somewhere I read, I never heard this before, that it expires after 90 days and you have to do it again.
The DNR?
Yeah.
Oh gosh, let me look it up. I know, well, let's look that up together. Um, I think with the most and the post, let me hang on, let me look it up.
The thing that I was reading about the DNR was written in 2014.
Okay.
So,
It says that the expiration of a do not resuscitate order varies depending on the state and the specific circumstances. Some states' DNR orders have no expiration date. In other states, they may expire after a certain period of time, such as 1 to 2 years. If a DNR does expire, it is no longer valid, and healthcare providers are obligated to attempt resuscitation if the patient experiences a medical emergency. However, it is important to note that DNR orders can be revoked at any time by the patient or their healthcare proxy. State laws also might change, so it's best to consult with your healthcare professional or attorney. If a patient, this is interesting, I've seen this before. If a patient has a DNR tattoo, that is not legally binding. Some people have the DNR tattooed across their chest, so that's not legally binding. Unfortunately, they're still required to provide CPR. And so let me go back to like a post. Does a post expire? So let's see. The physician's order for life-sustaining treatment, the post is generally valid until the patient or their healthcare agent changes, or revokes it. There is no expiration date for the post form. So, I think if the patient's status changes dramatically, going from a DNR to a post form would be highly recommended. Some people I know have a post form. I'm with a circle of real strong advocates in the community that are solo agers, and they're all very active in their group of supporting one another. And quite a few of them actually have pulse. But that doesn't mean if you have a pulse, that if you fall and break something, that you should not get medical care. There was an interesting situation that one of the people had a post. We call them posts here in Idaho, and oh, hang on, I'm seeing that there's people in the waiting room. I'm so sorry. Let's see. Hi, Thomas, Stacy, Sydney, Gina. Welcome. I'm so sorry I kept you in the waiting area. Welcome, everybody. Hi, Jacqueline. Thank you for coming. We were just talking about uh, um, posts and the difference between the DNR and if they're legally binding, if they expire. And we were just talking about the DNR, the DNRs and the pulse or posts. The posts do not expire, but DNRs, it depends on your state requirements. So we were just discussing, encouraging, looking up what each state requires for renewal. But what was I talking about, Clarice? The folks. So a man had a post, and he had a stroke, and it was a pretty extensive stroke, and he didn't want any. He just said, "This is it." And the wife said, "Okay, this could be it." And so they called hospice, and the hospice team said, "We're not going to be able to be out there for several hours." And so they waited, and so he lived, and now he has some pretty detrimental effects from delayed treatment of his stroke. So he's having to go through speech therapy and occupational therapy and physical therapy, whereas perhaps if he would have sought medical treatment right away, they could have administered the clot busting medication. So really, when someone is showing signs and symptoms of a stroke, it's really imperative to seek medical attention right away. So so it was a eye-opening experience for them all to really begin. So we just began to have really important conversations around that. I think I mean, for me personally, I hope that I die in my sleep. Like, I wish that for everyone, but that isn't the case for everyone. So when we start talking to family members and loved ones, and even our clients, about having all of these different scenarios, present some different scenarios of what could happen. Someone could have a massive heart attack, and do you want CPR or do you not? Do you want CPR? And if the CPR is ineffective and there is significant brain damage, would you want life-sustaining efforts at that point? And so really begin to tease out all of these different situations. So anyway, I know I talk way too much, Clarice. I hope that that helped answer your
Oh,
question, but it comes
yep,
up a lot.
yep, that was fine. Thank you.
You're welcome. You know,
Yeah.
in Idaho where I'm at, there is this the Health and Welfare website, and it has a advanced directive that is so extensive, and you can just fill it out online. You can send it to your people, and then you can register it with your state. I was really impressed by what they had available. So you might just want to check and see with your state what they have. It was really quite robust compared to other DNR or other advanced directives that I've seen in other states. So they've done a really good job here. So I'm hoping that they have done the same in your states. Yeah.
I'll just say one more thing. It's interesting how my family is responding. Some people really want to do it. Some people are doing it to support me and
Yeah.
kind of really don't want to talk about it so much because they're going to do it. And my sister, who lives in Rhode Island, doesn't want to do it because she's really private and she
Okay.
feels not comfortable talking about it publicly. And I said, well, you could still attend just to learn, but not share anything, you know? So we'll see how it goes.
Good for you. I think that's being so brave, right? Because sometimes it's just those are hard conversations to have, so hard. And I love that your family is willing to step into that space. It's probably not going to be a one and done conversation. Mm.
We have, for the most part, all of us have been present at the death of my mother and my aunt and my uncle. So we've had these conversations about the generation before us, but not us. So I'll let you know how it goes. Thank you so
Thank
much.
Oh, you're welcome. Please do let us know how it goes. I would love to hear how it goes. I think, yeah, it's so important, so important. And I think, you know, we wear so many hats, but really tending to our own affairs, our own getting ready to prepare for ourselves. I mean, if I get anything out of this class at all, if I have no other clients, I know that that I feel less fearful, and then I can kind of help other people feel more brave to have those conversations. Yeah, excellent. Good work. Good work. Jesse, there was one other question in the chat. I want to grab it. Um, so Antonia says, isn't the DNR part of the most? It is. It is. But the most or the post, it is. It is. But it is more legally binding because the DNR is there's so many people that have DNRs, but most or a post is really legally binding and is something that is strong is kind of a requirement for people when they are in the hospice setting. So it's really like the final say. So so yeah, good question, Antonia. So Maria asks, please confirm how many weeks will we spend in the elder care and care consultant segments. Yeah, I'm super excited for you guys to dive in there, and everybody should have access to those training programs currently. Everybody should have access, and so going to your classroom, you will have your CEOLD training, which we're working on. And then you should have access to your elder care and care consulting, and you can start working on those at any time. So technically, we always try to encourage people to, like, especially we have done, Doula Givers has done the life semester as well as self-paced courses. And so you can do all the training concurrently, but we get really excited when the live semester is available because it's just so fun to be able to do it all together. But you can start doing the other ones as well concurrently. If you ultimately, this is, you know, the
the CEOLD, and then the elder care, and then the care consulting, if you were really ambitious, you could have all of it done in 16 weeks and then just start flying. So if that's something that you're interested in, you're welcome to do that. Yeah, and those are so robust trainings as well. The care consulting piece is something that really well, all of them actually can really begin to launch your business quickly, because you can start working, helping people doing their advanced directives. And then there's one doula giver. Her name is Adrienne Alate, who really took off with her elder care training. She would be someone that you would want to watch in the doula giver group. She's amazing because she has just fully launched her elder care business and is like crazy busy. So it is possible as you build your doula business. So please explain how our final course exam takes place. Oh, great question. Okay, so I just want you to know, Tana, thank you so much for that question. So so you guys, this program is so robust, and this, especially this last homework that you guys are working on, is really a review to help prepare you for your exam. So if you have gone through each of the modules and you have done all of your homework, you will be ready to take your exam. And my tip for you is to not wait. Do not wait to take your exam. For some folks, sometimes people have a little bit of test anxiety and things like that. Please just take it right afterwards. And then so you want to be sure, and we say this, hope, we remind people after each of the classes, but you want to be sure when you are in your module in your classroom to please mark complete and make sure that you've completed all of the modules up to this point, because what that will do is allow you at the end of the training to be able to take your exam. And so I don't know how many questions, maybe 35 questions, but they're multiple choice. And if you guys have, if you have really followed this program and have done the training and have done your homework, you're going to be ready. This is this the test is like there's no. I didn't feel like there were any sneaky questions. They were just um, answers that you probably already know because you've done your homework. So, and then also, Doula Givers is offering the DSIDMA, which is this extra level of support as you launch your business. And so, I would just strongly encourage for you guys, if you finish the course, take your exam by, I think the date was July 22nd. So by the end of the course, you'll get 3 months of this DSIDMA. It is so worth your time because it will really help. It's kind of like an accountability group, and it would really help to like accelerate. There's so much information there. Yeah, as far as taking for tips for the program, for the exam, you guys, just what I did personally is I just reviewed the homework, and I didn't go through all of the videos unless it had. I think I graduated in December and I took my exam in January, and it was like I was so surprised. It was like, oh my gosh, I know this. And we just repeat the same information over and over again, show you some ideas about care plans, different scenarios. How would you handle that? You guys are doing amazing. You're showing up every week. You're going to be prepared. You're going to be totally prepared. Suzanne says, be careful with DNRs and dementia diagnosis. Once the patient is diagnosed, signing legal docs is tricky. It is. It totally is. In Suzanne's 9 choices document, she touches on that. So that's why it's really important to have those DNR or the all of those paperwork, all of those things, the advanced directives and all of those forms be signed well in advance. Especially if someone is starting, if you're noticing that a decline quickly, it's really important to get all of those paperwork, all of those. Okay, so Alyssa, yep, you got your hand raised. Okay, so Jesse, you've had your hand up for a while. Good to see you. Hello.
Uh, did you say Alessa?
Oh, I noticed in the in the chat, you were asking how to raise your hand, and I said, "Yay, you found how to raise
Yeah.
your hand."
So my turn, or I need to wait for my turn?
Oh, you know what, Jesse? Do you mind if we let Alyssa talk?
That's
Okay,
fine.
okay, yeah, go right ahead. Good to see you. Thank you for coming.
Hello, Christine. I have a question. So about the practicing skills with elderly. I would like to ask your advice. I'm not vaccinated and I do not plan to get vaccinated because I have some medical issue after the car accident and I just cannot do it. What would be your advice? If I would have a doctor's notes, would hospice take me as a volunteer, or there is other ways how I can fulfill this requirement?
Yeah, so that's a great question. I think that especially nowadays, most hospice companies, most medical facilities honor, if for there's a disclaimer that says, I decline these vaccines. I'm fully aware of the risks of not being vaccinated, but it's kind of like it's against my religious personal beliefs, or you have a health condition that you're unable to take those vaccines. So that should not be a reason for them to not allow you to be a volunteer.
Okay.
I think during COVID, there were some, you know, some rules, but we're past that now, and so really, you could bring a note to the doctor, but the hospice company or the facility should have a form that you just decline them, and that should be good enough. The other option too is sometimes they require vaccinations, just proof of like verification of vaccines. So have you ever had vaccinations?
Yes, I have all of them, and
Yeah.
actually, I had the reaction when I was trying to update them. I had the reaction that
Oh,
I
okay.
found. The
Okay.
only one that I don't have is a COVID one. Everything else I have, and I have the proof that I had them.
Perfect, perfect. So yeah, that should be all that you need is either
Oh,
verification of the vaccines. And if you don't have verification of the vaccine, then there would be a blood test, an immunity test that you have
yeah, I
verification that you have the antibodies.
have it twice, so it should be I should be
Okay.
covered.
Perfect. Yep, perfect. Yeah, it sounds like you got it.
But because I didn't started that process yet, I know that I won't be ready to graduate in July. I can take the test, right? Uh,
Yes.
Completion. But is it okay if it will take me a little bit longer to complete the practice
Yes.
requirement?
Yep, absolutely. And don't forget, so yes, I just want to say that again, that you do not have to have your bedside hours in order to graduate with your class. And so you just have to finish your coursework. You have to take the exam,
Okay.
hopefully by July 22nd. And then what that really does is allow you to step into that space of this extra group, the DSI-DMA.
Okay.
But we understand that the bedside hours take some time, but also remember too that you can use any past experience with that may count towards your bedside hours. So if you have any past experience, you'll want to be sure and send a message into support@doulagivers.com, and then they'll be able to determine if you can use some or all of your bedside hours. So I always
Also,
think, oh, go ahead.
I have experience with one or two people, and I can send it for partial acceptance.
Absolutely, absolutely.
Because
Yep.
I would like to go and work with hospice at the present time, because my experience were a long time ago and it's
Yeah.
different country, so I would like to get experience, so when I get my practice hours, then I would be able to receive the certificate and graduation certificate. Is that correct?
Yes, that's correct. And so we can't really say that we can't say you can't start practicing as a doula giver after graduation unless you have fulfilled all those requirements, including your bedside hours. Once you get your certification, you'll turn everything in, you'll get your certification, and then you are like a full-fledged active doula giver. But the bedside hours, to your point is, yeah, I really encourage people to get as much practice and as many what I call hands-on training before we step into the space. And if we can be volunteers for a hospice company, it's a beautiful, beautiful way to get experience. So
I'm very clear right now, Christine. Thank you so much.
you're
Thank
welcome.
and
Thank you for coming.
yes, I know that I usually do not turn my video because I'm doing something, but I really appreciate that in-person sessions. I think they are much richer than just recording. And thank you so much. And I appreciate the whole community. It's a very warm, supportive community.
I
Thank you.
think so too. You're so welcome. You're so welcome. So glad that you're here. Caroline had said the bedside hours 15 or 30. It's 15 hours. And just to go over, I have my little cheat sheet of what is required for bedside hours. So you can use past experience. Um, Bedside hours include volunteering at hospitals, hospice, nursing homes, hospice houses, any religious organizations, even assisted living, independent living. It needs to be at least 3 patients, can be more, but no more than 5 hours per patient. So one of your patients you need to be present during the vigil state where you're sitting vigil. And then the other person is you have to be at the time of death. So that would be, and they can't be the same person. So you can't sit vigil and be at the death of the same person. It has to be 2 different people. And so that's 15 hours total. So really just being at the bedside, and that one has to be the vigil and one has to be an active death. So, and what you'll do is you will, on at the end of module 1 is again what I just read. It has the requirements and guidelines, and then also there's a verification form that you can simply. There's no one that needs. You don't need to have anyone else sign. So you will be signing it. You'll completing it. You'll be completing it. You can actually just snap a picture, send it to support@doulagivers.com, or you can scan it and email it, and then the team will take a look at that to verify your hours. So if you have that now, I would encourage you to do that now. That would be one less thing to take care of. If you're still trying to get your hours, that's okay. Take a breath. Just think about where you would like to get those done, and we have all different people have all different scenarios that are happening. In ways to get your bedside hours. So, Jesse, thank you. Oh, Lisa, it was nice to see you. Thanks for your patience, Jesse.
Hi.
Hi.
You kind of mentioned a heart attack thing. So my question has to do with that. So when you have a client with a sign form, you're supposed to be able to get as much info about their diagnosis and that. Is that correct?
You're kind of breaking up, Jesse. I'm
My
wondering.
internet.
That's okay. I'm wondering
Can
if
you
you turn off your camera. Sometimes that pulls a lot. Not that we
Okay.
don't want to see your beautiful face,
No, that's
but let's there you go. Yeah,
there.
so let's
Is
try
that
that again.
better?
Uh-huh. Yep, I can hear
Okay,
you.
so do they give you any back information about the patient's past medical issues?
So I missed that first part of the question. Can you expand a little bit on that?
Okay, so okay, I guess I'll break this down better. So like well, my husband had a defibrillator in him. And so when he passed, they had forgotten, and he was at a skilled nursing facility, they had forgotten to put the magnet on him. And that got pretty intense. So my question is, if you've got a client that has a diagnosis, terminal of cancer, but in his past, he's also had heart issues, and has a defibrillator pacer in him, is this something you should maybe address with hospice to make sure that there's a magnet available or something's been done? And if so, are they the ones that would have the magnet or?
Yeah. Yeah, you know, that's such a great question. And I'm sorry that you had that experience with your husband. I'm sorry that I'm so sorry for that. Just for those that aren't familiar with what Jesse is explaining, some people have pacemakers and some people have pacemakers and defibrillators. And so the pacemaker just paces, notices, like sometimes people will have irregular heart rate, sometimes they'll be really fast, sometimes they'll be really low. And so they'll put a pacemaker in that will stimulate the heart to beat if it goes below 60. Usually they pace them at a certain rate. And that just keeps your heart beating at a regular rhythm. And people actually, don't need to turn a pacemaker off at the end of life. The body will just, excuse me, just the pacemaker will just know, okay, it's time to shut off. Sometimes the life of the battery will end, and they decide to not replace the battery in the pacemaker, and then they'll have their end of life experience. But in Jesse's situation, there are defibrillators. And what happens is the heart will stop, and it's actually an internal defibrillator where it will give them a shock. It will get the heart beating again. It's not very fun for the person to have that done, but it is something that some folks choose to do. So what hospice is supposed to do, the facility is they're supposed to have an awareness that, oh my goodness, this person is getting close to having their end of life, and they should have this awareness that, oh my goodness, this person has a defibrillator, and they can actually remotely turn off the defibrillator. There's also a magnet that will prevent the defibrillator from doing its job to restart the heart again. So in Jesse's situation, it sounds like they did not do that, which is really unfortunate and can be uncomfortable and all sorts of things. So yes, Jesse, to your point, the hospice company should have an awareness, but the family members also, not all family members, should have that awareness to also let the healthcare providers know that they need to do this, but not everybody has that awareness. And so, as a doula, we don't always go into their full uh, health history. That might come up in conversation when you are filling out your paperwork with your client. There are questions about any health conditions. We may want to know. We would want to know if someone has diabetes. Just because if they're on certain medications and things like that. Again, we're not the medical provider, but it wouldn't be. It wouldn't be. It wouldn't be. I mean, I would maybe mention it to the hospice team if you have a relationship with them, to go ahead and just mention, oh, I understand that they have a defibrillator. Are there steps that that are going to be taken when that decision is to turn it off? Or they like Jesse, did they not have any conversations with you at all about that, or did you? Like, I'm not sure where the miss in communication happened there.
No, no, that's was going to be my question. I mean, okay, because he died of brain cancer. So there wasn't his death was not because of his heart issue, and that had taken place quite some years prior to the brain cancer. So I don't know if they even knew, this happened pretty fast.
Yeah.
And I didn't realize, what would go on. So I do now. So And then that was the first part of my question you couldn't hear. If you are given some information about their health, how would they, because maybe this defibrillator was put in years before, would they have that knowledge, the hospice team? Or is that something, again, the doula could gently try to find out that piece of information for them?
Yeah, I mean, I think that, again, we're non-medical professionals,
Right.
right? So it's really the job of the hospice team to collect as much historical data as possible when they admit them. They
Okay.
also have access to medical records, but sometimes, people have other underlying conditions that are not related to the diagnosis of what they were admitted to hospice for. So, like a gentleman I took care of who had just a really rare cancer type, but he had just a horribly enlarged prostate, and it didn't come up in care until he was getting close to the end of life, and his wife kept saying he needs a catheter. We couldn't get a catheter in him because his prostate was so enlarged. And so,
Ah,
it's just so all of these things kind of are unfortunate, but but I do think that as a nurse, I'm caring for my client. I'm probably going to see their chest at some point and notice that there's an implantable device in his chest. So I'm not really sure how that was missed. But I think as doulas, we have, and also just trusting your intuition. But again, in your paperwork, when we start working with clients, there's going to be a form for them to fill out, any medical conditions that will be important. And then, we're going to develop a relationship with the hospice team to be able to say, gosh, they put this down there. What are the plans for the defibrillator? If, yeah, I'm so sorry, Jesse. I'm so sorry that happened. Yeah, it sounds like it was a lack of communication and a lack of awareness, and it,
well, in 15 years, and the procedure actually had been in a separate hospital, different
yeah, yeah,
from the one that actually um, the hospice team is from. So, I
yeah,
mean, yeah.
yeah, yeah,
So I don't know if that had anything to do with it, but yeah, that, and 15
yeah,
years is a long time ago. Things have gotten a lot better as far as communication. So,
yeah. And we have to also remember, here in Idaho, this is like people are moving in from all over the place. This is
yep.
like a hot place for people to move. And so not everybody's medical records are going to be complete. And so they're probably coming from different resources. And yeah, so it can be, and if something sudden happens, we just do the best that we can. So yeah, thank you, Jesse.
Thank you.
Yeah, you're welcome. I'm going to turn your camera back on so we can see you. Jacqueline, good to see you. Welcome.
I have a couple of questions.
Yeah,
We'll
for
start, we'll
sure.
start, we'll start with the easy one.
Okay.
Um, you guys talk about hospice all the time. And at least in my area, there are at least 3 different hospice companies. And I'm guessing they're not all the same because they're 3 different companies. And I don't know if people realize that there's more than one. When you say hospice, it's not just one. There's multiple potential businesses out there. And also at uh, assisted livings, they'll have a preferred provider for hospice, not necessarily uh, you have to go out and find one. They'll recommend one. And hospitals will also recommend based on do they have in person or at home or whatever. But I'm just not sure if people realize that there are choices. And I'll just that's sort of the first thing, which leads into uh, in the past 10 weeks, I've lost both my father-in-law and my father. So we've had two final exams, sort of, to speak recently. And at least with my father-in-law, he was in the hospital. Palliative care team was beautiful. We had vigil. They talked about hospice and options to go. He had Parkinson's for years. He had been on a feeding tube for more than 5 years. So some of the things you talk about that people aren't eating, he couldn't eat or swallow. So the two big things of knowing when the end was near didn't really apply because he couldn't do these things for years. Uh, Ended up it was aspirational pneumonia that was the ultimate cause of death. He did get on hospice and go home, but it was only 24 hours before he passed. So that was when you say people don't get on hospice soon enough, that would be one of those. But my mother-in-law said if I put him on hospice, it's showing that you're giving up. So there's needing to learn more about hospice and what they can and cannot do and what the situations are. And it looks like hospice really wants you to have cancer as the magic diagnosis to get put into hospice on one level. Do you have any thoughts or comments on how to get over some of these humps before I start
Oh,
on the dark side of it?
oh my gosh. So I just want to acknowledge those are huge losses, Jacqueline, and I am so sorry. That's a lot, a lot, a lot. Uh, I'm really grateful that you're here. I'm really grateful, situations like that and just my own personal situations looking back, that just creates this fire in my belly and making me more makes me feel more empowered to, like, we have a long ways to go, but I want to just acknowledge those losses, Jacqueline. So thank you for being here and sharing that. Those are really hard. Um, and just the thought of 2 points, being admitted 24 hours before someone passes away. Like, oh my gosh, that's painful. Whereas support could have happened much sooner than that. And then, the thought of, oh my gosh, now they're on hospice, and so now we've given up. And no, when someone is admitted to hospice, they're not giving up. There's just so much that can be done. Um, I think too, to your point of really being mindful about, just those telltale signs of not swallowing and, understanding that transitional period, it looks different for everyone because if they are already not able to swallow, then that may not be a strong indication that they're heading into their transitional phase. I really want to speak to also what you said about the facilities and choices. Like we have, as our role as doulas is empowering clients. Like, you have choices. Just because the hospital is recommending this particular hospice company, you do not have to go with the hospice company. And actually, we are interviewing them, they are not interviewing us. And I have seen some instances with some hospice companies that they, it's very salesy. We're going to offer you this. We're going to do this and this and this. And then it's just like, what in the heck did I just sign up for? Right. Um, going to the hospital, we as doulas, when we are helping support people, is reminding people that they have choices. And this is crazy, but we actually have 36 hospice companies in the Treasure Valley in where I live. It's crazy. and it's insane. I think there's now 29 because the smaller ones got kind of absorbed by larger corporations. It's crazy. That is just crazy. So really being able to identify that there is one hospice company that might be a good fit, that may not be a good fit for the other families. So thank you for bringing that up. Was there anything else, Jacqueline? I think I wanted to make sure I touch your questions.
Yeah, and I'll give a disclaimer that some of the stuff might be hard to hear, but we're going to go there anyway. First thing, I know we always talk about, are there any acute dangers in the home of the person? And I'm going to put up that those lift chairs are extremely dangerous, especially if the person is not sturdy on their feet. They will launch you out, and you will get broken. This is so we'll segue into my father, who was at an assisted living, and had infections and never was clearing, but he's old. He was 87. The assisted living facility said that he should get one of these lift chairs, but he could not walk. So you should not ever have one of those lift easy up, easy out, easy down chairs if you can't walk, because they will launch you. He was transported back and forth from the bed with one of those Hoya lifts. So he should never have had that in his room. Somehow the button got pushed, flipped, or before that, they sold hospice as they will give you all the help and support you need, including the wheelchairs that you won't have to buy. So when you said that some of the hospice places will just try to sell you, be careful. Be careful. So he did get the support for about a month, which helped him because he's upper body strength. So they had this great wheelchair for him, but now he's on hospice. And no one told me, the daughter. So he had been on hospice for 2 months, and no one told me, the daughter. My mother didn't. I found out kind of circuitously. The facility didn't. No one did. So I'm going through this program, learning all of this stuff, and I don't know. I don't know these things. So then the lift chair flips him out, breaks his hip, but he's on hospice. And my brother says, oh, he's going to have surgery. So you think, okay, all is well. They're going to have surgery. No, no, no. He's on hospice. They did not do surgery because he's on hospice. They sent him home with a broken hip. So now he's in a Hoya lift, extreme pain, I'm gathering. Can't move. He's now getting a lot of morphine because of the pain. I'm thinking because he broke his hip, not because they didn't fix it. Remember, he's on hospice. And then, well, he had a Foley catheter. Let's just say you don't want one pulled out. They sent him back to the hospital with a broken, yeah. Did nothing and sent him back to the facility because he's on hospice. So at what point does hospice, I know they say you can get off of hospice, but if you get off of hospice, you have to return everything that was helpful. And the scare tactics of, oh no, now you're going to have to pay for all of this when you've got someone who's now got a broken bone and a broken penis. And whatever you do, don't look up Foley catheter accidents. Just don't do it. And someone's on hospice. So when I say my father died tragically, and then we tried to fly out in time, and he passed while we were in the Denver airport. So I didn't even get to see him before this because we're in California and they're in Ohio, because no one told me anything. But when they said he stopped eating, I'm like, okay, I got to get on the plane immediately if he's not eating. But by then it was too late. So I'm in this program learning all this stuff and feeling extremely guilty because I trusted people. So as a learning experience, don't necessarily trust family members. Make sure people are informed uh, of your clients, because there's always some drama with families. But if you trust too much, you may not get to the root or get to the forgiveness phase or get to even understanding, why party A is not talking to party B and party C is trying to keep everyone uh, safe by not telling the real situation. Like, people won't ask for help because their house is messy. They won't call an ambulance because their house is messy and they're ashamed. Or they're ashamed and they're afraid that they're going to call social services and get thrown out of their house because their house is messy, or they're in a hoarding situation. So these are things that you don't think about until you encounter them. So I think some more of the danger and the psychology of why somebody, I know in the last class we talked about why people wouldn't call for help if they fell on the floor. Uh, but I think there's a deeper side of someone living alone in their home with a lift chair that might be hoarding, that's easily going to trip and fall and be there for a couple of days without nobody noticing. There's all these situations that um, you think are fiction, but we as doula givers need to think about, and like, what are the dangers in here? And the danger might be they just don't want you in the house. And why don't they want you in the house? But I've sort of digressed. But no, this program has really, really helped me a lot. I just wish I would have learned more sooner. But this is amazing, and I'm so glad I'm here. So.
Oh my gosh, I'm so glad that you're here. Thank you for sharing all of that. I think I too have had experiences of just personally and professionally where things didn't go as well as we had hoped. And it's really hard. It's really hard. All these unfulfilled wishes of, not every, we hope that, death can be beautiful, but it can also be very messy, and there are some unfortunate things that happen. I am so sorry about all of that with your dad. And you're right, those lift chairs are amazing, but there are people that should not be in them. And also the situation about the catheter. And I'm so sorry. That sounds super painful. Um, I think that I just want to take a moment and just recognize that sounds like just a really hard situation. And you're right. The reason why people may not want someone in their home for those exact reasons, right? And so safety concerns. And I think really we as doulas just really we want to try to just meet people where they're at in a non-judgmental state. And safety, of course, is our always top number one concern. But really, just trying to do the best we can. We can't take 30 years of hoarding away. We're not going to be able to help in that situation. All we can do is just meet them where they're at. I did want to speak to the idea of your father being, having the hip fracture, and so in my understanding is that if someone is injured, if they've had a fall, perhaps they fell and they cut their head open and need to have stitches, they can actually go into the emergency room, have stitches, and then be discharged from the hospital. They don't have to be discharged from hospice. But if someone has an overnight stay, then what would happen is that they would be discharged from hospice services,
continue to do their care in the hospital or rehab or whatever that needs to be done. And once they get discharged from that environment, then they can be readmitted back into hospice, which so in the case of, I think of a situation of someone in that group, that solo agers group, her husband had a brain tumor and he fell, broke his hip. They chose to repair the hip fracture. They chose to repair that hip fracture. So he went through the recovery, went to a rehab, discharged back home onto hospice. The next day, he was so confused, he fell and broke his other hip. Crazy. So they went back to the hospital and they chose to repair the other hip fracture. So he's recovering from both hip fractures and then was readmitted back home onto hospice and died 2 weeks later. I don't know. I'm not in a place of judgment. I don't know what the right thing is for people when they do break their hip and they're on hospice. I've seen it both ways where they've broken their hip, they've done the x-ray. We're going to just provide comfort measures and just keep the person at home. So I've seen it go both ways, super painful, especially when people are being needed to be moved around in the bed. It's just unfortunate either way. So my heart just goes out to you, Jacqueline. Thank you so much for sharing that. You know, there are several people in this group that are going through really deep levels of hard right now. Life is in full session, and we are boots on the ground, getting these training, but we're also getting life training, and we're all here to support you. And I really just want to encourage each of you to please post in the Facebook group about these challenging things, because I have a feeling that you're not alone, and I think it really helps when people know that you've had this experience. It's like, oh my gosh, me too. How can I support you? And the last thing I want to say is just give yourself some grace. Hindsight is always 2020, and I know for me personally, if I would have known then what I do now, would I've done things different with my people? Yeah, 100%. But what we can do is really be in a space of having love and compassion for ourselves. What an incredible doula you're going to be, Jacqueline, because you have this knowledge. Hard way to learn, but giving yourself some grace, and the forgiveness will come when you're ready, and it's going to take some time, but mostly forgiveness of yourself. You showed up. Yeah. So I'm sending you all sorts of love. You're welcome. You're welcome.
We haven't done the forgiveness workshop that I think is included in this course.
Yes.
You really need to. It is amazing. So.
It totally is. And and I'm always thinking about forgiveness of people, but really I have some work still, forgiveness of institutions and government officials. I mean, I've just, there's just a lot of forgiveness work that can go much deeper than just forgiveness of friends and family, coworkers. Yeah, it can go across the board. So super healing. Thank you for your willingness to go deep. You're welcome. You're welcome. Elizabeth, good to see you.
Hi, am I unmuted?
You are. Hello.
Whoa, okay, thanks. Yes, I signed up for this course because I have a brother 2 years older than me who's 72, who was put into hospice due to congestive heart failure and a lot of other things. So I said, oh, and I don't know how to take care of him. I don't know how to do. So I signed up for this course, and my brother, who has always been late to everything, was early this time. He broke all of the expected rules and norms. Long story short, I went over, he's about 2 hours away. I went over and stayed at his house, hospice home, last Saturday, and family was in and out and in and out, and he wonderful hospice nurse Annie and the other two RN or LPNs who helped with his daily care. And so I was the overnight person. We'd gotten to the point where he can't be left alone. So I'm staying, and then people come in and out. I had some great moments with him and clarity. He went downhill pretty fast, got catheterized. Finally, they allowed him to catheterize him because he was exhausted. He was up to the bathroom with his walker X number of times. And so catheterized him, made his life so much better and so much easier, and higher levels of meds. He I think it was the death rattle, it was the gurgling, it was the gargling. He stopped eating about 5 days. He passed away yesterday, is the long story short. But the night before he passed, he wasn't able to clear his secretions anymore. And I did give a under the tongue secretion med. So I was under the direction of the hospice nurse. And as that night progressed, then he's not able to clear his secretions. And it sounded like he was gargling. The as he's trying to breathe, it's just gargling breaths in there. And it was awful. It was just really, really hard to listen to. I called the hospice nurse, Annie, what, listen to this, what should I do? And she said, he's not grimacing, he's comfortable, and you got to let it go. He's comfortable. All the meds are up to date and up to time. And I left yesterday morning at 8 o'clock to come home for a few things, and his covering family friend Denise came in, who's also an RN, and he passed while she was there. I'm so glad, I have learned so much from this program from the start as to what to expect, what to understand, and why they'll wait till somebody leaves to pass by them. She had been in with him, and she stepped out to the living room for something, came back in, and there he was. He'd been having when I left yesterday morning, there's shallow breathing, real short and shallow. And I said, wow, this isn't good, because his breathing had changed. I went and so I pulled up the sheets to see his legs. So the nurse had said, we're going to look for the modeling on the feet, and it's going to work its way up his legs. And when it gets up to about his knees, things are going to be happening. Well, I checked his legs before I left yesterday as an indication of how much time I might have. No modeling, no nothing. No modeling, no nothing. Okay, well, I'm saying goodbye to you, Dave. And I did say a good goodbye. And then, 3 hours later, he passed. I suspect his heart probably gave out at that point. He had very, very weak heart. I guess, and something, a gem that I will pass on that I learned from you folks was, so we were told, all these things bother us, 5,000 times more than it bothers them. And so, and I learned a good lesson. I had a little aromatherapy jar and it had like eucalyptus and spearmint and all sorts of wonderful smelling lavender. And if you just take a sniff, you can sniff it. So I was using it with my anxiety with my brother, and I said, "Hey, Dave, maybe he's not responsive. I'm going to put some under your nose, and you can sniff this too." And geez, his eyebrows went up, and he did respond to it. So when the hospice nurse Annie came in, this was 2 days ago. I told her what I had done, and she smiled, and she said, Betty, that's really comforting for you. And it may be comforting for him, but the harsh reality is we don't want to help his breathing. We don't want to help his breathing. Our goal is for those apneic spells to go. He was at 30 seconds of apnea every minute yesterday. We want those spells to go a long time. So it was just a shock. I'm in such a habit of helping to comfort and prolong life that I wanted to give him, here, maybe this will make you feel better. And wow, what an eye opener.
Oh my gosh. Thank you so much for all of that. Just want to send you some love around the loss of your brother, and just really, it's just such a true testament of like things, um, we want to be there, and he apparently needed to do this on his own, right? And
Yeah.
it's beautiful. Oh my gosh, you shared so much. That those terminal secretions, that from what I understand, it's not uncomfortable for the person experiencing that. And sometimes even the medication, the drying agents that we put in their mouth just actually causes their mouth to just dry. It doesn't actually dry up the secretions, but
Not down
feel
there.
like
Yeah.
I feel like sometimes we want to be helpful, and it is hard to hear, and yeah, it is really hard to hear. But sometimes just doing a little bit of repositioning might help, but sometimes nothing
Mm.
helps. Sometimes raising their head up maybe 45 degrees, lowering it down a little bit. Sometimes just repositioning them off to the side will kind of clear that. They
Oh,
will,
yeah.
as they're actively dying, begin to have, like, it's not a intentional swallowing reflex, but you might notice a swallowing reflex, but trying to clear. But I think that you did amazing. And I'm kind of the thought of, I do like essential oils, and if I find it comforting, my person might find it comforting as well. But yeah, I think you're so right to your point of, like, we do everything we can to keep people alive, and that seems so intuitive, right?
Mm.
You did beautiful. You did beautiful. Good
Thank
job.
you.
You're
Thank
welcome. And
you.
just yeah, rest. Give yourself some
Yeah.
time to rest. And I say, job well done. Job
Mm.
well done.
Thank you.
You're
Thank you.
welcome.
I know that I said, well, I was not there for time of death, but I have just sat bedside vigil for hours and hours and hours. And that I will log and use.
Perfect. Perfect.
Yeah.
Yep, perfect. You could only do I think 5 hours.
Right.
So,
With,
but
with,
you could use that as your vigil hours, 5 hours of your vigil hours.
okay. Yeah.
Perfect. Yeah.
Yeah.
Good
Does
job.
it have 5 hours vigil hours and does it also count as 5 hours with the patient, or is that separate and in addition to?
You know what? I would send that question in to doula
Sure.
givers. Yeah,
Okay.
I think it needs to be three separate patients, three patients, at least three different,
Yep.
5 hours maximum per patient. So
Right.
maybe only use that experience as one, it sounds like, but please clarify it with them.
Sure. I will.
Yeah,
I will.
good.
Thank you all. I just needed to touch bases with you today after that. Thank you.
Yeah, you're so welcome. We're just sending everyone in here, so much love. Um,
Thank you.
Rhonda, good to see you. Welcome.
Hello. I
Hi.
decided to hop on while I'm working and kind of listen. And I just had some questions. It's been very nice listening to other people's stories. And I've had some of my own and everything, but I just kind of had some logistical questions, I guess.
Sure.
One was, so my goal with this whole program, I've taken 2 other certifications for doula, and then I have this one now. And then my goal is really on the being proactive and educating. I wanna have meetings, schedule meetings and have people come, kind of like how Suzanne got started and everything. And so one of my questions was, we have all these resources, and I don't want to impede on any kind of copyright information. So I guess, like, what can we share and what can we not share? Like, I know, like, the forgiveness, there's different things that are offered free for anyone. So, if we send them there, I don't think that would be an issue. But I also wonder about, like, actual pamphlet or, printing something off you know, I want to make sure that I'm within my legal rights and the program's rights of being able to share that, if that makes sense. I don't want to just give things out because I have access to them. I want to make sure, you know, or do I need to redesign everything for my own personal things?
That's a great question. So, Suzanne and Doula Givers are so generous with their educational materials. Anything that's on the website as free resources, you can share. I think that what we want to be mindful of is to not change it, and because it is proprietary to Doula Givers. And so, as you guys continue to go through the program, you are going to be given so much more. They're on the free resources. There's the patient comfort tracker. There is I forget what it's called. Something about where you can. I'm not using the right word. Some like planning and support. So planning for support, like all of that stuff is available to use. So, however, you know, as far as if you're wanting to change. You also, after you graduate, you'll be given an email that has patient intake form, you know, your disclosure, your intake form, your all sorts of things that will be made available for you. So you can use what Doula Givers has given you. You can just print those off and use those. The Doula Giver logo will be on there. However, if you want to create your own, you're welcome to. I would be mindful about creating something that's, you know, exactly what Doula Givers, I wouldn't just cut and paste and call it yours when clearly Doula Givers has created that. But we want to always make sure to give Doula Givers credit for I mean, this is just thousands of hours of work that they've done. And so for me personally, I created my own um, um, intake form and that has a little deeper consent, and you know, after we'll talk more about insurance and things like that that you guys would want to get, but that'll come later. But I think really if you are wanting to create something on your own, I would encourage you to submit it to Doula Givers if you're using part of their stuff and maybe a spin-off using your own. I would submit it to Doula Givers for approval. But I think anything that is um, on the free resource pay on the free resources page, you are welcome to share and use because it's already available for people. So I think
Yeah,
when in doubt, always ask for some guidance from support. You know, I think the I've been doing the Good Death Seminar series, which has been amazing, and I encourage anyone to maybe consider doing that, as well as the Good Death, Good Life Cafe. I'll be starting that next month here in the community. I'm using all of Doula Giver's resources, and then and then I have my extra stuff off to the side. I have other flyers and stuff available. So, yeah,
yeah.
yeah,
Because like over the years, because this journey has been very long for me, I have been putting together different things, especially like keeping track of everything, you know, because when someone passes, it's like, what are the passwords? Where are the accounts? All that
yeah.
stuff. And so I've been working on a electronic version and a paper version of that for years, trying to capture like everything. And I'm just so grateful because all the tools and stuff, I don't want to have to recreate them. So I just wanted to make sure that I could use them and I wasn't impeding on anything that way. You know, like if I did a talk and, you know, it was a free resource, I could give that to them or tell them where to go to access that, you know. I'm really, I understand the whole sitting vigil and having the clients and everything. And that's very important. But my passion right now is the proactive, you know, just getting people talking about it and, you know, and really, you know, letting people know that they have alternatives and they have options and it's better to do it, you know, like my thought is when they're 16, start having that conversation. When they're 18, have them start signing things, even if they're not gonna. And I guess that comes from, because my son has cystic fibrosis. And so when he was born almost 30 years ago, his life expectancy was 28, which is how old I was when I had him. And so all through life, we have had open and honest communications, and that's one of the blessings of having a child with a terminal illness. And so, I want to take that knowledge and spread that to others, that it's okay to have those conversations. It's okay. It's not saying, one thing or the other. It's just our society has gotten so fearful and pushed it to the back that we're not giving people the opportunities to prepare the way they want to. Another question I had is, so I've been there for, I've taken care of my two uncles who have died from kidney issues, and then the other one died from liver issues. Also having boyfriends that have passed and needs a heart and lung transplant. However, I guess as far as the training goes, so I signed up to do some training with the hospice, but they don't allow any vigil work for a year after signing up. So I just don't know. I want to make sure that I'm doing my training appropriate, because I would like to finish within the time frame to have all those advantages and everything. So I'm just wondering, is there anything else I should, how those should be categorized, and, and are all the hours bedside, or are, if I were doing talks or something, does that also count? Because I understand the bedside part, or does it all need to be bedside? So I know that's probably a goofy question. So
No. So the bedside hours, it's just bedside hours. So I don't think that you can use talking to the community as part of your bedside hour requirement, because this is for the certified end of life doula training portion. So bedside hours are just related to end of life. So 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 I would just encourage people to finish the program, take the exam, try to get your bedside hours in. You can use your past experiences, try to get that done as soon as possible. And that way you'll have received your certification. So for the CEOLD. So the elder care and the care consulting, you can be doing that right now. If you are able to do it, I would encourage you to do that. You could ultimately get all 3 certifications in 6 weeks or 16 weeks from starting this program. But Suzanne talks about it. Even though you can present yourself as saying, I'm in training, I am training to become elder care specialist, care consultant, a certified end of life doula. I'm in training. And you can start planning on having these events in your library. You can start doing all of that now, because it takes some time developing relationships and takes some time getting on the books. So I would encourage all of you to just start making steps in that direction. But as far as the bedside hours, those are specific to the end of life doula part.
Okay. And that was where I was wondering, the 15 hours is considered bedside hours, right?
Yeah. Yeah.
Okay. Yeah. And I know, I've pretty much already had all the hours through past experiences.
Yeah.
But I just,
perfect.
I just wanted kind of something newer and stuff. So if I use those past ones, or if I want to get some more through, maybe starting with another hospice, then that wouldn't make me wait so long. I just want to make sure I meet that, by July 22nd, having everything done.
Yep.
So,
yeah. Yeah. And if you feel like you have enough past experiences to qualify for your bedside hours, just turn that in, have the team review it right away. And that way, if there's any question, you might need a little extra in this area, they'll be able to direct you. But yeah, I would just turn it in and see what happens. You might already have completed the requirement. And then by the time it's you've reached your graduation, you'll have received your certification after you take your exam, which I just want to tell you guys, don't be afraid of the exam. Like, you're all going to do great. We can all get in our head about, oh my gosh, the test, the test. Like, you're going to do great. Suzanne has done an amazing job getting you prepared. So good, so good. So please don't be
So
afraid.
in regard to the exam, I don't mean to take up more time, but is that like a essay type thing? Is it multiple choice? I've taken two other certification exams already, and I just want to say yes, if you're doing the work and you're in these conversations, the tests will come easy. It's a lot of common sense and a lot of what we learn, at least in my experience with the other two certifications. So, but I was just curious how this exam goes. Like, do you have to go somewhere? Is it proxied?
Nope, it's
Anything
just
like
all
that?
online. It's just all
Okay.
online. And if I remember, so it's been 5 years since I've taken the test, to be honest with you. I don't think there's any essay questions. I think it's mostly multiple choice. So,
Okay.
so I think that, and I think there's maybe 35 questions. It's just, yeah, you guys are going to do amazing. They're really, it's well thought out. Yeah. I do want to spend some time with you guys doing happy hour too. So I want to make sure you guys have the 30 minutes. Jesse, go ahead.
There. Can you hear me?
Yeah.
Okay. I just had a quick question. Since I'm doing this strictly to be able to volunteer for the veterans, which there's a large number in my county, by the time we're done with this, is there going to be any, because I want to get the word out about this amazing program, is there going to be any update when they may be offering the next class that I could, tell someone?
Yeah, for sure. So I think that I think they're planning on having another live semester this fall. So I don't know if that'll be September or October. Yeah, yeah. So there'll be another one. Yep.
Good.
Yeah.
All right. Thank
Thank
you.
you. Awesome. Miss Maggie, good to see you.
I thought I was going to put it in the chat, but I just wanted to say to y'all, I took my test in July of 23. I started the class stuff in 21. I didn't really finish until 22, and I worried about it for over a year. I would look at it during the year, and then I'd go, oh my God, well, what if I fail it? All that kind of crazy stuff that you tell yourself. And I'm here to tell you that it was not, I'm not going to tell you don't study, because much of it, you will have learned going through the class, but don't make it get bigger than it is. Don't be afraid of it, because I really wasted a year not doing that. And I'm really having, I'm not saying have regrets, because we all learn, but I just want to tell you, I know what that test anxiety is, and I have test anxiety, so I understand that. So if you have test anxiety, do what you got to do. The other thing I found really helpful is, once you finish or as you're studying, make note cards, take some index cards or something like that, and just make it really simple. Okay, this goes with this. And then that way you're not doing the whole big old notebook that you probably are taking as you go now. And it simplifies it, and you're right on point with it. Y'all will do fine, because you're here. If you're here and you do class and you do your work, I don't see any way in the world you can fail. And you're right, Christine, there is no essay. At least in 2023, there was no essay. It was seemingly multiple choice is what I believe. It might have been a yes or true or false, or yes or no or something, but you got it. Just like I say, I wouldn't go sight unseen, but for God's sake, don't do what I did. Do it, do it and get on with it. Because once you get over that curve, you'll be a lot better off. I promise.
Thank you, Maggie. Thank you so much. So much. Yeah, I can make something much bigger than it is. So thank you. Trina, last question, and then we'll go out into the breakout rooms. Good to see you, my dear. I'm glad you were able to make it with us today.
Me too. I was camping with my granddaughter last Friday. I had
Aw.
counted on being here last Friday, and I was like, oh no. But at any rate, I had something to say about the thing that was said just before Maggie, and I've already forgotten what it was she said. What did she say? It was very simple, and I just wanted to, well, at any rate, doesn't matter. Another thing that I did want to say is that for those of us that come here because we're not on Facebook, and those of us who are from Wisconsin, this was a Facebook event. You're not going to be able to see it, of course, but that one of my friends forwarded to me that is happening tomorrow. So I don't know if you're, sorry, this is very Wisconsin specific, but we have a natural death, kind of forest that's privately owned, the Farley Center out here. And tomorrow, the Natural Path Sanctuary is having a death education market. Right? Exactly. I am thrilled, personally thrilled. So I'm going to be there and hope to make in-person contacts with folks. So it is Saturday, June 21st from noon to 3 p.m. And again, that's at the Farley Center, which is 2299 Spring Rose Road in Verona, Wisconsin. And it is the Death Education Market. So if any of the Wisconsin folks are able to come, that would be, I mean, I think it's going to be, I'm so excited I can't hardly handle it. And so I think it'd be a good place to connect. And so I just wanted to throw that out there. I do want to also, I don't have test anxiety. I am awesome at tests, actually. However, I have, as Christine, pointed out, like we've got some folks going through difficult things. And I don't want to do my bedside hours until I know I'm not going to do this in their place. And I want to graduate in time, but I need to be okay because I'm dealing with my own stuff and regrets around death of my own loved ones and complicated grief. So how do I balance my need to graduate on time with the need of my customers, for lack of a better word, my patients, for me to hold their space and not my space? So that is a little bit of a tricky situation for me right now.
Oh, Trina, thank you so much for all of that. Yeah, thank you for sharing. I hope that everyone can make that event this weekend. That sounds super exciting. I just love, like, we're a very unique group of people, right? Like, we get excited about this kind of stuff, like death education. Oh my gosh. So, and just honoring Trina, like, my heart just goes out to you. So do not feel pressured at all to get your bedside hours. If it's triggering, if it just feels like it's too much, all I ask is that each of you consider finish the course and take the exam. Bedside hours can come later. Sometimes it takes a while. Sometimes they're for many, many, many reasons. As our hearts mend from losses, and you're right, we can't be triggered while we're caring for people. But that's the beautiful healing process of this program, is that we heal. We begin to heal and work on that forgiveness stuff. So that's all I ask, is that you guys consider just finish the course, take the exam. You can always do your bedside hours later. It's okay. It's okay. So give yourself some pace. This is not a competition at all. It's, people take time and life happens. People are having losses, people are having big life stuff happening in the middle of all this. Life is in full session, so just give yourself some grace. We just really encourage people to just try to finish the course with your group, take the exam, because sometimes people pause on that part, and then just work on the bedside hours later. Yeah, I'm just honoring where everybody is at. It's not a race. It's not a race. Take all the time
I just
you
don't
need.
want to lose anything. Like that it's not an insignificant amount of money that was invested in
Right,
the program.
right.
So I would like to be able to make use of any resources that are, awarded, again, for lack of a better word, for finishing on time.
So with that, that's another thing, is that take advantage of graduating on time, getting your coursework done, make sure the whole program is complete by the end of week 12, take the exam, and then you will qualify to get the 3 months of the DSIDMA, which will absolutely help accelerate your business.
But
Absolutely.
that can happen without the bedside
Yeah.
hours? Okay.
Yes. Yes.
Okay,
Yes.
that is a
Yes.
very helpful
Yeah,
clarification.
you
Thank
don't
you.
have to. No, 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 no. Just
Okay.
all you have to do is just complete the course, take your exam. Please
Okay,
take your
I
exam,
will.
finish the course, and this
All right.
DSIDMA is going to help accelerate. Like, it's for me, business is not intuitive. That's my weak spot. Like, I know how to care for people. I feel like I got that down, but this is really going to help accelerate your business component, your business part. All right, so let's break out into breakout rooms. Can everybody stay like 5 minutes later? Because I really want to honor 30 minutes. Okay, and if you need to tap out, that's completely fine, but I really want to spend 30 minutes in the breakout room so that you can all get to know one another. Just share your heart, share where you're at. You know, maybe remember we're in week 8. Remember, what is your why? Why are you here? What has brought you to this space? And there's several new people too, so be sure and introduce yourself. Welcome. Be sure and allow time to spend. Each person has a time to share. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. If anybody, Gina says she's only going to be able to listen. That's fine, Gina. We're so glad that you're here. So is everybody able to stay? Clarice is leaving. Okay. All right, Clarice. Thank you for coming. Good to see you. You're welcome. Everybody else. Oh, Suzanne says she has to go. Suzanne, thank you so much for joining us. Appreciate it. Thank you so much. Good to see you. We'll see you in the group and in class. Thank you so much. Okay, is everybody else staying? Suzanne is leaving. Okay, looks like everybody's gonna stay. So that's 3, 3, 6, 9, 12, 15, 16, 17. Okay, so I'm gonna break us up into rooms. All I ask for the new people is that when you get into the room, please be sure and hit got it, or it just there's a little message about recording. So please be sure and click that button. Otherwise, it's just gonna sweep you back into the main room. I'm probably gonna do 2 or 3 people in a
So
room.
sorry, I have to go.
Okay, no problem. Thank you for joining us. So I'll start putting you guys in the breakout rooms. And let's see, 3, 6, 9, 12. Sorry, I have to count in my head. So there's 16, there's 15 of you. So I'm going to put 5 rooms. So, at least 5 minutes each or longer. We'll come back I'll give you guys a message. We'll try to do 30 minutes if you guys can stay. So I'll give you a message about a minute before we're about, ready to go. So off you go. Enjoy, get to know one another, have fun. Thank you guys so much. Gina, are you there?
Welcome back. Welcome back. Never seems long enough, does it?
No.
No, that was great.
Good, 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 good. And always, you guys always come back just so smiley. I love it. I love it. I love it. I have the I don't know. It's just fun to see everybody's face come back, and I wanted to just say how excited I am for you. This last month is going to go by so fast. There's a lot of information that's coming, but I just love that we still have a month left together because there's so much more connection that we can make. So it's yeah, we're just welcoming everybody back. Carolyn, you have your hand up.
I just wanted to ask if we can go ahead and take the test.
Yes, actually, you'll need to make sure that that you've completed all of the courses. Did you start
Right.
the program a little sooner?
I didn't understand that.
Oh, did you start the training with the live semester, or did you start the training prior?
I started it with the live semester, but I've been going ahead.
Yeah, I think as long as you have gone through all of the modules, I don't see why you cannot take the exam if you feel like you're ready. We do encourage people to go through the live semester, but if you are moving ahead and you're anxious to get going, I don't see why not. Feels like you're frozen, Caroline. I hope that helps. Perfect. Okay. Are you guys hearing feedback? Yeah. Okay. I'm not sure where that's coming from. Okay. There were so many questions in the chat. I just want to let you know that I'll pull out the chat and be sure and answer those questions when I get the recording. So I know there's some additional questions. Just want to be mindful about everyone's time. Thank you so much. This is like so fun for me. I just love seeing all of your beautiful faces, and I just love seeing you come back afterwards, making those connections. I hope that you guys will continue to stay connected in the group, and then also be sure and share your information, you know, especially if you live close together or not. I have friends all over the country, like my friend Maggie, who's in Georgia, long ways away. But, you know, as we have been on this journey together for a while, these beautiful relationships begin to develop and deepen. And I just know that I have some great, tremendous support all over the country and all over the world. So, yeah, Rhonda, one last question, and then we'll probably need to get going.
I just wanted to say that I did put that link for the map for everybody I put it in here as well because I know some people aren't on Facebook. So feel free to share it if you're, you know, talking with someone individually and they haven't got, but you can just go ahead and add your own little pin, and then hopefully we can all kind of connect that way too, make it a little easier.
Awesome. Trina, are you able? I know you're not on Facebook. Did you find that in the chat? And maybe Rhonda, you can set, I know Trina's not on Facebook, so maybe if you want to send your contact information to Trina, so that she might be able to connect that way. Are you finding it, Trina? Did you find the link on there?
Trying to do the map. I can't find my Zoom meeting, but I was just bookmarking that map before I
Okay.
disappeared. Now I'm lost, but I'm glad you can hear me.
That happens to me more times than I'd like to
Oh
admit. I'm
God,
like,
that's
where'd everybody
crazy.
go? I hear you. Yeah,
Oh,
yeah. You're back. Okay, good. Okay, so good.
okay.
Yeah, bookmark that. And then Rhonda has graciously created
Yes,
this
and
link
thank
so
you
that
so
we can all
much.
stay connected. Excellent. Well, I enjoy spending my Friday morning with you all. I wish you a beautiful weekend and you're doing amazing. And I look forward to seeing you in class and in the Facebook group. We're just all here to support you, cheering you on. You're doing amazing. I can't imagine spending my Friday morning any other way. You're all beautiful souls. You're doing great work. So have a great weekend, okay? Thanks so much, you guys. Bye.
Bye. Thanks, Christina.
You're welcome. Bye-bye. Good to see you, Maggie. Thank you for coming.
Said I'm sorry I was late. It was one of those
All good.
mornings.
It's all good. It's all good.
We've got a good group of women. Very
Oh
good.
my
That was
gosh.
great to get, and that was wonderful to have that time to get to
Yeah,
know them. I got their phone number, so I'm going to text them and kind of
good,
encourage and do those kinds of things. So
good, good,
anyway, all right. I
good.
think you're doing as well as you can.
Yeah, we're doing good. Yeah, I'm just heading off to a meeting right now, meeting a hospice nurse who's interested in doula work. So I just kind of wanted to support her and
All right. Well, good luck. I hope
yeah.
that goes well. Hope you have a great weekend.
Thank you, Maggie. You take care.
All right.
Bye.
Bye.
Bye, Diana.